And if we take a look at, the winter wave as the possibility of this coming again, and you look back to last year, Thanksgiving, where we were, in terms of, rates of infection once everybody came inside, do we really need to be concerned right now?
I mean, I think if you watch what's happening around the world, in Germany and other parts of Europe, rates are going through the roof, as are hospitalizations and deaths. What we are seeing, however, is that in those countries with high rates of vaccination, the numbers are significantly lower. It's an important conversation to have about breakthrough infections and safety, and we certainly should not let our guard down. But yes, I think we do anticipate a surge. And the reality is that there are a number of things we should consider as a result of the surge, one of which is the multi system inflammatory syndrome in children you mentioned earlier.
All right, we know New York City, Dr. Chokshi came out announcing he's issuing a commissioner's advisory to all healthcare providers so that there are no longer barriers for New Yorkers to get a COVID booster. We know there's other states that have made, this similar move, Colorado, California, New Mexico, saying, hey, booster shots for all adults. Do you think that we're going to see that here in the tri-state just, across the board?
Yeah, I think that's probably coming. I mean, what we know for certain is that somewhere between 6 and 8 months after the Pfizer and Moderna vaccines, a little later for Moderna, and after some period of time as well for Janssen, that your immunity and your protection begins to wane, and that's pretty typical for most vaccines. If you think about the annual flu shot that's recommended and other vaccines, so I think we are going to see that the immunity wanes over time, which is expected, and that booster shots will be, a necessary part of the continued fight against the pandemic. So I think right now the Department of Health in New York City has issued this offering. I think the New York State Department of Health certainly will follow suit, and the governor alluded to that yesterday in her own comments.